Hi, hello, welcome viewers. இன்னைக்கு நம்ம எதை பற்றி பார்க்க போகிறோன்னா infection endocarditis. Is the carditis meaning for tis means infection. Infection spread for the endocardial endothelial surface of the heart. This is the mainly affect for the endocarditis. The epidemiological for the mortality ranges 20 to 30%. Most affect than the male than female only affected. The classification acute and subacute. Acute means affect normal heart valves, rapidly destructive and metastatic foci. Subacute often affects damaged heart valve, endolated nature. Pathogenesis. This is for altered valve surface. Animal experiments suggest the IEE almost. Bacteremia. Pathogenesis. Hemodynamic factors is the most commonly site of infection. Aortic valve more common than mitral. Aortic vegetation usually ventricular aspect. All three cusps usually affected. Perform and preparation of dysfunctions of valve root abscess. Mitral dysfunction of rupture of chordae tendrae. It's mainly for clinical manifestation. Fever, most commonly only fever symptoms. Anorexia, weight loss, malaise, night sweats, heart murmur, patch of the skin, conjunctiva, oral mucosa. Splenomegaly is the main causes. Right side of endocarditis associated with the peripheral emboli, pneumonia and pulmonary findings of peridominant. Clinical manifestation is the fever for 80 to 95%, chills 40 to 75%, wet 25%, anorexia 25 to 55% is the most non-specific and splinter hemorrhage non-specific, oxalar nodal more specific, painful and erythematous nodules. It's the common for the diagnosis. 1994 group of Duke University standardized the criteria of assigning patients suspected of endocarditis. It's the most common for the define of echocardiogram. Diagnostic purpose for the echocardiogram is the transthoracic endocardiography. This is the rapid and non-invasive, excellent specifically poor sensitivity of heart. Obesity, chronic obstructive pulmonary dissections and the chest wall deformities. Transesophageal echo, more invasive, is the sensitively and up to the 94% is useful for the prosthetic valve and the evaluated myocardial invasion. Negative pediatrically valve is the 92% of valve affected. Is the microbiology is the very important of the vulnerable status. Is the most common microbiologist test blood culture. Blood culture means minimum of the 3 blood cultures, 3 separated venipuncture sites. Obtain 10 to 20% of ml adult, 0.5 to 5 ml of children's. Positive results, typical organism present under 2 separate bottles. Complications, 4 etiological. Embolical, local spread of infections and metastatic spread of infections. Local spread infection is the aureus and subacute phase of the non-aureus. Principle of medical management is the sterilization of vegetation. Therapy, streptococcal or enterococcal, MIC, penicillin. Penicillin is the most aminoglycoside, ceftriaxone and alone. Vancomycin, aminoglycoside. Haig group, ceftriaxone. And surgical therapy is the indication of conjunctive heart failures and perivalvular invasive disease. Uncontrolled infection despite the maximal antimicrobial therapy is the major embolism, large vessels and heart block. Surgical therapy is the mainly for the heart attack. Heart attack means the standardized regimens. Thank you everyone.